So today's topic is about mitral valve insufficiency, right? So question is mitral valve insufficiency, etiology, pathogenesis, complaints, diagnostic, treatment. So of course, once again, my beloveds, try to be maximum specific. So mitral valve insufficiency, mitral valve means between left ventricle and left atria, right? So mitral valve insufficiency occurs when the mitral valve doesn't close tightly, allowing blood to flow backward into the heart. Where backward? From left ventricle to left atrium. So let's outline the key aspects. So I repeat, mitral valve insufficiency occurs when the mitral valve doesn't close tightly, allowing blood to flow backward to the left atrium. Of course, it's not okay. So if they want etiology, so mitral valve insufficiency can be caused by several factors, including two principles ones. Well, there are several, but anyway, first of all, of course, degenerative changing associated with aging. So all peoples with aging got mitral valve insufficiency. We can say that. So aging is actually it's a risk factor, but anyway, degenerative changes associated with aging. Degenerative changes associated with aging, changes of mitral valve, of course. Second, now we know that it's a rheumatic fever, but also can have infective endocarditis, infectious infective endocarditis, mitral valve prolapse, and coronary artery diseases. Any type of coronary artery disease. Yes, and there's also connective tissue disorders. Okay, so let's repeat etiology. Degenerative changes due to aging, associated with aging, rheumatic fever, infective endocarditis, mitral valve prolapse, coronary artery disease, and some connective tissue disorders might be the etiology of mitral valve insufficiency. About pathogenesis. So malfunctioning of the mitral valve, either due to structural abnormalities or functional impairment, leads to the backflow of blood from the left ventricle into the left atrium during systole. So malfunctioning of the mitral valve due to structural abnormalities or functional impairment. So so-called regurgitation. That's why actually we don't say mitral valve insufficiency. We said mitral valve regurgitation. Correct? No, it's not correct. It's a question of tradition. In Western hemisphere of the planet, say mitral regurgitation, or just regurg. We said insufficiency, actually the same thing. The regurgitation of blood can lead to volume overload into the left atrium and ventricle, eventually causing chamber enlargement and potentially leading to heart failure or some arrhythmias, especially mitral valve. We talk about arrhythmia, atrial fibrillation. So about complaints, clinics, okay? Patients with mitral insufficiency may experience symptoms such as signs of heart failure, because it's a heart failure. So what is the principal sign of heart failure? Of course, it's a shortness of breath, especially during physical exertion, or if it's a situation is very bad when lying flat. Fatigue, palpitations or irregular heartbeat, swelling of the ankles and feet, that's so-called edema, and reduced ability to exercise. Concerning diagnosis of mitral valve insufficiency involves a combination of clinical evaluation and diagnostic techniques. No, of course, it's after taking all complaints, principal factor. So physical examination, including auscultation for characteristic heart murmurs, echo, now it's a test of choice. echocardiography to assess the structure and function of the mitral valve and chambers of the heart. ECG, sometimes, why not, to evaluate especially heart rhythm abnormalities and detect signs of chamber enlargement or strain. It's actually now it's after echocardiography. It's not principal at all. At my time it was principal. Now it's echo. And chest X-ray to assess the size and shape of the heart and detect signs of congestion or fluid accumulation in the lungs. But anyway, it's first of all of principle. One is the imaging techniques, and the test of choice is echocardiography. So if you said just physical examination and imaging techniques, for example, echocardiography is largely sufficient. Concerning treatment or management, what about management? Management of mitral valve insufficiency depends on the severity of the symptoms and underlying cause, and include medications to manage symptoms. First of all, we manage heart failure, such as diuretics to reduce fluid retention, or medications to control blood pressure, especially ACE inhibitors, and a heart rate. Now, why not beta blockers or digoxin? In severe cases, surgical repair or replacement of mitral valve. Of course, if we talk about severe cases, yes, of course. First of all, in principle one, it's lifestyle modifications. Physical activity, regular exercise, that is maintaining a healthy weight and avoiding tobacco and excessive alcohol consumption, abuse of alcohol. And finally, a regular follow-up, that is monitoring, to assess disease progression and adjust treatment as needed. So I answered 7 minutes. Of course, you don't have 7 minutes to answer each question. So try to be specific, and everything will be okay. God bless you. That's okay about mitral valve insufficiency. Largely sufficient. God bless you. See you in the next lectures, next questions.